Well, my name is Nathan. For the last, I would say 6 or 7 years, I've been having pain in my knees. The doctors gave me various injections, and they felt that the only real cure would be surgery to replace my kneecaps. They also put me on a physical therapy program, which included heat and exercise, which relieved the pain somewhat. But again, it was not permanent. It kept coming and going. I stopped using those people at that point. Whenever I heard of a medication, I tried it, like various creams. I spoke with the doctor about some other injections that were advertised. And his comments were simply, well, we could try them. Never really committing himself because he didn't know they were new things. After a while, I found more and more pain in the knees when I was lying in bed, especially when I put my knees together, and also when I sat for a while and had to get up again. Somehow through the center I got your name and thought, let me try something with this gentleman. I don't know what he's going to do for me, but we'll try. Before I came here, the best I could do was maybe 10% temporary change in pain.
Okay, and let's see. Was your diagnosis was arthritis? Was it not?
It's rheumatic pain in the kneecaps, in the knees.
Okay.
The cartilage is pretty well worn out, and I get the stiffness and pain. I had difficulty in, it started out with me having difficulty in standing up, difficulty in walking, and I tried to correct that by going to a cane. The cane helped somewhat. I wouldn't even put a percentage on it, but it gave me a little more self-assurance when I walked around because I had like a third leg. That got to be a nuisance too.
How long did you have the cane for?
Oh, I would say maybe a year.
5 of those treatments. What percentage better do you feel you are?
Well, I would say that at this stage of the game, approximately 80% better than I felt before. Of course, it fluctuates with the weather, and I find more often than not, I can relieve myself of the cane and still have the confidence to walk around. So I'm getting less and less pain. But again, it seems to last longer periods, and every time I do the routines, I find it reduces the pain quite a bit.
And what routine you talking about? Can you reflexercise?
Reflexercise, yes.
Mm-hmm. And just say a sentence that you've been coming to. After the 5 treatments of however you want to describe the new stuff that you're doing at the physical therapy doctor.
Well, I'm doing the reflexercises. I try to do them as much as I can when I remember. I get to about somewhere between 6 and 10 periods of reflexercise a day.
Okay.
And
that helps reduce your pain?
That helps me very much. The manipulation that you perform on my body seem to increase the curing of pain, as we see when we test it by checking those nerve endings that you press before you give me your procedure.
Right.
And then when we press them afterwards, the pain seems to have been gone. But
What
again,
can you do now that you couldn't do before?
well, I can, of course, walk without the cane. I can find that if the weather stays dry, I can get less pain in
Do
my...
you use the cane now?
On occasion.
Okay.
Not nearly as much as I did before.
Okay. And can you walk further?
Well, with
Can you walk with less pain?
yes, I can walk with less pain
How
now.
much? What's the less pain? How much percentage less pain do you walk with?
Well, when I consider the entire procedure, I have about 80% reduction in the pain from what I had when I first started with you.
And that includes when you walk.
Yes.
And how long has it been like that? How long have you been feeling that 80% or that high percentage better?
Well, I would say that high percentage increased to 80% when you started the reflexercise exercises. Mm-hmm. And of course the manipulation that you perform.
Okay.
I put them together, I assume. They
Yep.
work together.
That's right. And we did how many state
We
how many treatments?
did 5 sessions
Okay.
of the manipulation.
Mm-hmm.
And again, at about
And
at the rate of about 2 a week, and about 3 weeks of reflex exercises. Actually, situation, and
is it painful at all during the treatment?
not at all, no pain at all during the treatment.
Mm-hmm.
And as I say, after I complete a treatment, I feel completely at ease with my pains.
Okay. Very good. What would you say to somebody who is in pain?
I have mentioned this treatment to, not the treatment, because I can't even describe what you do, but the reflex exercises, I have mentioned that to a few of my friends. And of course, they're rather skeptical, as I was when we first started. But we talk about it, and hopefully, a few friends I'd like to get in here for this treatment, only they're out of town for the winter. I'll get them back here in a few months.
Okay.
I feel 80% better after the treatment's been given to me by the physical therapy doctor.